Hey, welcome to episode number 9 of the Go to Physio podcast. In today's episode, we talk all about effective explanation for complete patient adherence and buy-in, but most importantly, how to implement it in the clinic on a day-to-day basis. I hope you enjoy the show. Hey, welcome to another episode of the Go to Physio podcast. This is episode number 9, and in this episode we're talking all about effective explanation. Now, in episodes number 1 and episodes number 5, we talked a lot about the importance of setting patient expectations. So specifically in episode number 5, we talked about a very important formula, that being expectations minus current reality equals patient's level of happiness. So what we're going to do in today's episode is we're going to dig into setting patients' expectations and how to actually apply this. So if you recall in my 7-step business growth plan for my own private practice, step 1 is having clarity as a therapist on the true problem and solution, and having that clarity on getting a step-by-step graded exposure treatment plan in place. Step 2, which we're going to talk a lot about today, and we're going to go back into in deeper levels I'm going to dive into today, is the therapist to effectively explain the problem and solution to the patient. When we can effectively explain the problem and solution to the patient, that's where we can match their expectations with current reality, which is going to increase their level of happiness. That's going to have a massive effect on the patient having clarity on the problem. Okay, and it's also going to, from a business point of view, okay, it's going to have a massive impact on your cancellations, on drop-offs, people, not turning up to appointments and losing confidence in you as a therapist. So what we're going to talk about today, it's not got to do with hands-on treatment or rehab techniques or anything like that, but it has a very, very big part to play in getting that ideal outcome with the patient. And this side of it, I don't think is covered a lot. And it's something that I've dedicated a full mini course on inside my mentorship. Okay, so my go-to therapist mentorship, I have an effective explanation masterclass, if you will, where it's about a 10 mini lesson course all on the ins and outs of it. But what I want to do today is just give you the overview of it and give you bits of it to hopefully implement and get going. Okay, so as I said, if we don't have patient adherence, we're going to have drop-offs, cancellations. But not only that, the therapist may have or may not have clarity on the problem. But the big thing with the effective explanation is to get the patient to have clarity on the problem and the solution. Okay, so that they know why they're doing their exercises, why they're relevant to them, etc. Okay, now after years in trial and error, as I said, I've developed this what I call inside my mentorship as effective explanation. There's a process, there's a method that we go through. Okay, and that's what we want to get into today in a little bit more detail. Okay, so what I want to talk to you about today is having a look at the words that you're using essentially. Okay, now I'm not on about fear-mongering words or anything like that, although that that could be a whole new other episode. But what I want you to consider today is what actually makes for a good explanation. Okay, and if you think about it and just take a step back and think about what do we actually want the patient to understand. Okay, ultimately we want the patient to understand, as I said, the problem. Okay, obviously the diagnosis isn't necessarily the problem. Okay, the diagnosis essentially is the symptom, what's causing the problem, and the solution, because they're two actionable things that we can focus on. Okay, they're the two things that if we can get the patient to have clarity on, that they take action, then that's going to give us the best possible chance of getting that person with long-lasting, meaningful results. Okay, so in order for that person to understand what we essentially need them to understand, okay, in order for an explanation to be effective, okay, then we need to keep the wording very, very simple. Hey, I hope you're enjoying today's show. For more clinical content and tips to help you implement this content in the real world, please visit thegotophysio.com for more information, including my 6-step patient adherence checklist, which you can download for free. And also there's more blog content that helps you implement this stuff in the real world. You'll also find links to my YouTube show, the Go To Physio Show, as well as lots of more information to help you become the go-to therapist, helping real patients get real results in the real world. I'll give you an example here. If you read a textbook that's very, very heavy in anatomical terms that you've kind of never heard before, you'll probably get 2-3 lines into it, okay, and you're probably going to lose a little bit of interest because it's too hard to read. You start to think, you know what, this isn't, I'm not going to be able to understand this, and essentially you put the book down. Okay, this has happened to me. I remember reading I think it was a neurophysiology and a biomechanics book at one point. It's a really good book, but it's very, very heavy reading. And after a few lines in a particular chapter, I started to get sleepy. My attention started to go because it was so hard work. Okay, you contrast this with a book like Louis Gifford's Aches and Pains, who's written that book in such a simplistic way. Okay, he makes very, very complex situations and terms and kind of I suppose what's the word I'm looking for, topics, okay, and he essentially dumbs them down, okay, so that we can understand them, okay. And that's what I think we need to be doing with patients. Is I have a phrase that I use, and I use this in courses a lot, is I will always sacrifice accuracy for understanding, okay? And now I'm not talking about, telling lies or misleading patients, but, if you're not 100% accurate, okay, but that helps a patient to understand the ultimate thing or the outcome that we want them to get, that I'm very, very comfortable with that. Okay, so for example, as the foot hits the floor, I might say to a patient, 25% of the load is going through the calf, hamstring, quads and glutes. Now that's not 100% accurate, but I'm fine with saying that to them, okay, if it helps them understand that all of those tissues have to contribute to the absorption of that ground reaction force. Okay, so that's just a quick example. Okay, so keeping it simple, keeping the language on their terms versus ours. Okay, so the more words that you use that are new to the patient, okay, that's going to have a big impact on decreasing their confidence that they're going to understand this explanation. Okay, so the key to effective explanation, in my opinion, is using as simplistic words as possible in their world. Okay, so in my effective explanation masterclass, if you want to call it that, in my mentorship, okay, we use numbers and we use drawings that are very, very simplistic, that are essentially things that everybody's been exposed to. Okay, so we use an explanation that is in that person's world. Okay, whereas I think a lot of therapists, they try to explain what's going on with the body and they try to bring the patient into the therapist world, talking about all of these, anatomical terms, etc. Okay, so even going as far as calling, the glutes the bum, okay, or the thigh muscles, okay, stuff like that. Okay, keeping it very, very simple has a massive impact from my own experience. Okay, so that's the first thing that I would like you to reflect on, okay, in the clinic over the next coming days, is when you're explaining to patients, okay, and I suppose that's the first thing you want to be doing, is actually thinking, am I actually sitting the patient down and explaining the problem and the solution? And I find a lot of therapists, after mentoring, more than 275 therapists now all over the world, that some of them initially, they weren't actually, after the assessment, they weren't actually explaining to the patient the problem and solution. They were given a vague, roundabout, thing about, this or that, but they haven't actually sat down and explain what the problem is, but most importantly, what the patient needs to do and the plan. Okay, so again, we talked about this in the previous episodes, having that confidence to actually design that step-by-step plan with the patient. That's massive in terms of setting expectations of how many sessions it's going to take, and also so that they've got a realistic expectation, as I said, in what they're going to be doing and how these movements and exercises are specific to their situation. Now, a lot of therapists shy away from that, I feel, because they themselves as therapists don't have confidence and clarity in being able to deliver a step-by-step treatment plan. Okay, so as I said, working in professional sport, it's our bread and butter. I've been very lucky to be exposed to it from, pretty much day one of qualifying, whereas a lot of therapists, they haven't had the exposure to be able to even give prognosis or design a treatment plan from the initial assessment right through to the higher level, which is obviously why I believe in the mentorship. That's why I started to teach the mentorship. I'll be honest, I didn't think the mentorship would keep going as long as it did, but the more people I reached, the more I found that therapists needed this guidance, and when you gave them this guidance, that their confidence and their clarity shot through the roof, and it took care of a lot of the issues that they were facing in the clinic, such as patient adherence, drop-offs, cancellations, and it made a massive difference to their businesses, their private practices specifically, and also obviously to therapists who work in professional sport. And that's a big part of my job as well, is to go in and mentor head physiotherapists in sports medicine departments. And it's really interesting when I look at the progressions that you can always kind of see where things started to derail when they started to skip steps in integrated exposure plan. So I think it's really, really important that the therapist has clarity, but also the patient has that clarity on that plan. Okay, so gone a bit sidetracked again. If you've been listening to a few episodes, I do that. I apologize. It's something I'm working on. Okay, so the key thing from this episode that I'd like you to take away is I'd like you to reflect on, actually, after the initial assessment, are you sitting the patient down? Have you got their full attention? Are you explaining to them the problem and solution in their terms, in their world? Or are you trying to get them to conform to your world with all these fancy terms? Okay, count almost, if you can, how many words in a common explanation that you'd use that patient is probably hearing for the first time. Okay, and if it's more than 2 or 3, then I would suggest that that's very intimidating for a patient, and their confidence levels may start to drop, just like yours would, mine would, if we were having a discussion with someone and they used 3 or 4 words in a sentence that you had absolutely no idea what they were on about. You'd probably politely start nodding and smiling and pretend you knew, you had half an idea what they're on about. Okay, so again, the explanation needs to be effective. The explanation needs to ultimately give the patient clarity on the problem, the solution, and the plan, which is going to have a big impact on their adherence, drop-offs, and obviously their motivation levels. Okay, they know the plan. Okay, and as I said, it's made a massive difference. It's probably the best thing, the effective explanation that I've implemented in my own clinic. Okay, it's a work in progress. It's evolved massively over the last 12 months. And to be honest with you, in terms of feedback from mentorship therapists, that itself is being fed back as being, for a lot of therapists, the best part of the mentorship. Okay, and it's not even about hands-on. It's not about rehab or assessment techniques or anything like that. It's about communication skills. Okay, and as I said, I've dedicated a whole module, if you will, to effective explanation and communication, because I think it's very, very important. Okay, and as I said, our therapists in the mentorship, especially when we do them in the refresher days, it's brilliant to see, and some of them, they've taken our effective explanation method, if you will, and they've made it their own, and how they've tweaked it as well. And I'll always joke with them, and I'll rob bits off them as well, and I'll put my hand up, and I'll cheekily say I'm taking that what you've done there with the drawing or with the or with the explanation and how they've worded it. Okay, because as I said, there is method behind the madness, and it's a very, very important part of our skill set as therapists is the communication. Okay, so as I said, it's the best thing I've implemented, but in order for a explanation to be effective, I think first and foremost the therapist needs to be clear on the problem and solution, so then they've got confidence in actually explaining it to the patient. But then during the actual explanation, that's where then we implement what we've talked about today, where we keep the words very simple. We use terms, we use visual aids that's in their world and not ours. Okay, so give that a try. See how you get on. If you want more information on our bit, on the effective explanation module, or the mentorship in general, then reach out. And as I said, there'll be an accompanying blog and accompanying YouTube video with this. If you head over to www.thegotophysio.com/blog, then you'll see the accompanying blog on effective explanation. And we've also got the patient adherence blueprint free download, and you can also grab a copy of my book if you haven't picked it up. And there's lots of other free loads of other free resources there, so make sure you head over to www.thegotophysio.com/blog. Okay, so that's it for this week. Thank you for your attention. I really appreciate it, for giving up your time and listening to me. If you've got any questions, as I said, head over to www.thegotophysio.com, and you can contact us there, or check out our Facebook page, or Instagram, Twitter, all the usual. You can just search for Dave O'Sullivan's Pro Sport Academy, and I'm sure you'll pick us up there. Okay, that's it for this week. Short and sharp, but hopefully you've got some stuff that you can implement in the real world, which is what this is all about. This, my mentorship, why we do the podcast, the YouTube shows. It's just all about helping therapists in the real world get real world results with real patients. It's not about just putting something on the internet and sounding smart. For me, anything that we teach or that we put out there, you have to be able to implement in the real world, and that's very, very important to me. Okay, that's it for this week. I will see you on the next episode, when we are going to switch gears again. We've got some more good content coming up. We're going to talk about feeling rushed in sessions, and how to get that clarity, which we kind of touched upon today. And then we're going to go back into more practical content again. Then we're going to talk about deceleration. We're going to talk about modifications I've used to the Nordics, rotator cuff exercises, deliberate practice, and lots more coming up in the coming episodes. Okay, so I'll see you on the next episode. Make sure you head over to www.thegotophysio.com and pick up your patient adherence checklist. You grab a copy of my book there, and there's also loads of blogs and resources there as well. Okay, so I'll speak to you soon, and have a great day. Hey, I hope you enjoyed today's show. For more information, please visit www.thegotophysio.com, where you can download my 6-step patient adherence checklist absolutely free, as well as read the accompanying blog that goes with today's episode. We've got lots of cheat sheets and clinical content to help you implement to get real world results with real patients, that ultimately helps you become the go-to therapist and allows you to build a profitable, busy private practice, or become that go-to therapist in professional sport. I'll speak to you soon on the next episode.